Anthony Trupiano, president of Trupiano Associates, and we're in the greater Orlando area. I got contracted with Redirect Health so that we could give business owners another option. We noticed after the Affordable Care Act, a lot of the companies either consolidated or bought up. We'd usually have a dozen companies to go and quote for them to maybe 5 to 7 companies. And it's the same 5 to 7 companies that every other broker out there is quoting. So having Redirect Health gives us an option that other brokers don't have. And I would say most of the groups that we spreadsheet, when we put Redirect side by side with what their renewal is, I would say it's definitely in the 40 to 50% range, being Redirect is less. We're definitely seeing participation is up in companies that we write with Redirect Health. Most of the time the premiums are so much lower to the employer that the employer is either picking up the premium or the percentage that the employee used to pay of the traditional carriers, the more expensive carriers out there. Redirect is such a small amount that now healthcare is affordable. Okay, so the Redirect renewal and enrollment process is the best process I've seen in 21 years. When there's no medical underwriting and the prices are set, everybody knows what they're going to pay. It's just a matter of the employees just using the enrollment link. They'll get a welcome from Redirect Health. They'll sign up for the app where they can put their information in and actually get ahead of some of their prescriptions, doctor visits. We've been able to enroll groups when we're only 2 weeks out from their start date. With other carriers, we're probably, I want to say, a good 4 to 6 weeks, and we'd be lucky if they got a card in the mail, 6 weeks later. I haven't seen anything like that from a carrier. Like I said, I've been doing this 21 years. Nothing's even come close to that. The feedback that we're getting from the members is that 24/7, they're accessible. I know personally, being on Redirect, my wife and I, in fact, it may have been Christmas morning, that my wife didn't feel good, and we used the app, and a doctor called within 20 minutes on Christmas. I mean, I don't know another carrier on planet Earth that would have had a doctor call us in 20 minutes. They absolutely love having an app. It's like an Uber for medical. So Redirect Health, being a TPA, having everything really built in-house, there's less pieces to be broken or go wrong. The commissions are taken care of, the claims are being paid super quick. We're noticing that. It's not a runaround, with getting claims paid. So yeah, Redirect, having control of that piece and having it in-house is a huge advantage. Premium stability with Redirect has been amazing. There is a story I do want to share about one of our groups. It's one of our favorite groups that we've had for, I'm gonna say, about 15 years, and I think we were on the verge of losing them. They had a Cigna renewal that came in at 34% increase. The best I could do as a broker, shopping the market like everyone else does, the other carriers, bringing back in quotes. We got them down to about 22%, and then I started hacking away at my commission. A broker that works as hard as we do shouldn't have to be cutting my commissions because a carrier's increases are so ridiculous. I'm getting paid a fair commission, just like all the other carriers, and I don't have to negotiate my commission anymore because the rates are staying flat. Redirect Health isn't increasing the rates, they're keeping them the same. I'm not having to fight with that 20, 30% increase from some of these other carriers like a Blue Cross Blue Shield, United Healthcare, Cigna, Aetna. Probably a big piece of that is the fact that the premium didn't go up. And they're shocked. They're used to getting these huge increases. And on the flip side of that, important to mention, is that we now picked up 2 very large groups this year. We wouldn't have stood a chance of getting if we didn't have Redirect's pricing and their model. So it's not just the pricing that's attractive, it's the benefits actually matched up to some of these other big traditional carriers. If we didn't bring that in, we would be shopping the same carriers that the other brokers shopping. Again, it comes back to the members, the employees. The employer is bringing in a plan where it's affordable care now. It's meaningful health care for their employees that they didn't have before. I think right now, if you're a broker out there and you're just shopping the main Cigna, United, Blue Cross, Aetna, you'd be foolish not to look at Redirect Health because that's your inflation fighting tool right now.